Welcome to another episode of General Knowledge with me. Today I'm going to talk about hypertension, rather high blood pressure. What do we mean by high blood pressure? Normally, I tell my patients, just in simple terms, in a layman's language, this is how well is your heart pumping blood to the rest of your body. If your heart is struggling to pump blood to the rest of the body, meaning there is an increase in the pressure in around the arteries, meaning there is so much force that is being used to pump blood. So what is the normal blood pressure? Ideally, it varies from age to age, but normally we talk about 90/60 to 120/80. So you come to me and give me blood pressure readings of about 130/90. I will tell you your blood pressure has started rising, meaning we're having elevated blood pressure. If you talk about 140/90, three readings that are 4 hours apart, I'll say you're hypertensive. But on a single reading, I will not judge you for that day. I will tell you monitor your blood pressure for the next 2 weeks. If it is above 140/90, sorry ma'am, sorry sir, I will have to start you on drugs. If you come to me with blood pressure readings of about 160/100, I am sorry, I will have to start you on drugs. So when we talk about something over something, what do we mean? So the one at the top is always called the systolic. This basically is the pressure when the heart is beating. So the one at the top is the pressure when the heart is resting in between the beats. So normally the heart contracts and relaxes. So when the heart is contracting, so that is the systolic, and when the heart is relaxing, that is the diastolic, meaning they're over something. Yeah. So why is it important to always check our blood pressure? Importantly, this is a silent killer disease. Of all the diseases, this is a silent killer disease, meaning more often it will not give you any signs and symptoms. If you're very lucky enough, you'll have things like chest tightness, you'll have things like headache, you'll have things like dizziness if you're lucky. If you're not lucky, risk for heart attack, risk for stroke, or even risk for death. So what are the causes of high blood pressure? The causes are classified into primary and secondary cause. Primary meaning these are causes that have no specific cause. They have no specific reasons. When you talk about secondary causes, these are causes that are from another underlying disease. So when you talk about another underlying disease, we mean things like kidney diseases, can give you hypertension. When you talk about other causes that we're not able to tell well about, we talk about your lifestyle, we talk about your genes, we also talk about, of course, your lack of exercise, rather obesity. What are the risk factors of this hypertension? Why do some people tend to get hypertension and others don't? We talk about age. The more you grow, the more you're at risk of getting hypertension. We also talk about dieting. So check on your diet, less starch intake. We talk about less salt intake. Avoid at all costs the addition of table salt to your food. Also, we talk about less fat intake. Also, we're supposed to exercise. And again, I repeat, for exercise, it's 150 minutes a week. If you can do 30 minutes a day, you're good to go. Alcohol and cigarettes. If you're able to quit smoking, better for you. Alcohol, we can work on reduction of alcohol intake. Yeah. So also, again, lack of physical inactivity will make you a good candidate for hypertension. What are the signs and symptoms for somebody that has hypertension? Like I said, it's a silent killer, might not come with any signs or symptoms. How do we know you have high blood pressure? Somebody will ask you how will you measure to know if I have high blood pressure? We will measure by the BP machine, the blood pressure measuring machine, that will tell us what you have over whatever you have. So we will use that to say if you're hypertensive or not. Also remember, stress can also give you blood pressure. Yeah, so ensure you your working condition, your personal life does not predispose you to hypertension. How do we manage this high blood pressure? We talk about lifestyle changes. There are things that we can't manage, like your age. We can't really manage. We can't prevent you from growing older. We can't manage your genes or your family history. But let's talk about the things that we can manage. Things like your eating habits, or like when you talk about your eating habit, that's when less starch intake, less fat intake come around. Yeah, also limits the intake of red meat. Also, we exercise regularly, like I said, 150 minutes a day. A week, 30 minutes a day. Maintain a healthy weight. Your body mass index must be less than 28. So meaning you should not be obese. We start talking about obesity when your body mass index is above 30. When it's between 28 to 30, we say you're overweight, which of course it's a risk because you're soon getting to obese. So always check that your weight matches your height. You should not be too short for your weight. Limit your intake of salt and all that, and also quit smoking. All these risk factors are like they align with a lot of chronic conditions. If you're able to work on these risk factors that you can work on, the adjustable risk factors, then we wouldn't be talking about all these chronic diseases. So why is it important to monitor? You get to monitor when you get to monitor your blood pressure. Of course, we are able to know if you are at risk of starting drugs or not. So remember, the modification methods, like the prevention methods or the treatment methods, must not only be with drugs, but I will force you to take the drugs. Again, I repeat, if your blood pressure is above 160 over 100, there we're gonna fight. But if it is anything below 140 over 90, I can always advise that you check on your dieting, check on exercise, do your BP monitoring for the next 2 weeks, and always I say, bring it back to me for observation. So if we have to fight for us to get treatment, we're gonna fight big time. So again, a lot of people have been able to stop all these drugs, but you have to stop the drugs the right way. Don't just wake up in the morning and say, I'm tired of taking these drugs, or I monitored my blood pressures yesterday and they were okay, so I stopped. You did not start these drugs by yourself. Somebody felt that you were at the position you really needed to start the drugs, and whoever is in the same position will feel when the right time comes that you need to stop drugs. A lot of people have stopped the antihypertensive, so it doesn't mean if you start your antihypertensive today it's a life sentence or you're gonna take it for the rest of your life. I repeat, there's so many causes that can predispose you to hypertension. If you're able to work on these triggers of hypertension, a lot of times you're able to reduce the drugs or even stop the drugs. So let us all work together towards healthy living, and of course limiting the deaths and all these complications that come with high blood pressure. Thank you.